significant, and the part that I need to remind myself, and I would encourage everyone to keep telling themselves, is that almost every study on paper, and then almost every clergy family that I see clinically, both from whether it's a child and their parents are still in active ministry, or if it's retired clergy, even people that have left the ministry under duress or by choice, or adult children of clergy, they almost universally say, I wish that we'd spent more time with each other. Okay, so what about psychopathology and clergy kids? Again, there's really not much data. So just some observations I'll tell you about clergy kids. And they tend to gravitate toward me. I think part of it is that, number one, I ask. And then also we'll get people that'll come to me thinking, okay, you're clergy, I'm clergy, therefore you're going to agree that everything that I'm doing is right. And so, that doesn't always hold true. And then I've also been able to have some collaborations with some clergy support, clergy professional groups. I see a lot of depression, particularly around moves. And what I would say up front, though, is that, just like anything, biopsychosocial model, so what we know about depression and anxiety and all these psychiatric disorders is that they are really neuropsychiatric disorders. They are really medical brain-based disorders as well. And so if you look back a generation to clergy parents, what you see, second-generation clergy, clergy that maybe their call to ministry, even if they weren't second generation, came during dark nights of the soul that might have had a few shades of biological depression thrown in. So there really is a biological diathesis, can be, for this. Anxiety is really big. Am I good enough? Or I wasn't good enough. Will I be good enough? And then eating disorders, believe it or not. I have a lot of folks that are eating disorders. And why is this? Well, anxiety, striving to be perfect, all those kinds of things. That often doesn't get asked about in clergy children, and why is that? Is because historically the demographic, high profile, high socioeconomic groups. Otherwise, clergy have a lot in common with college professors, with business executives, the stereotypical eating disorder patient. So be sure and ask for that. Substance abuse, again, while the overall clergy population, kids population, may not be drinking and drugging as much, this does come up. When it does, it can come up in a big way. Obsessive compulsive disorder, I've seen a fair amount of that. It's like the underlying biological diathesis there, but then the emphasis on cleanliness, on purity, on holiness can really unmask that, and also a few other things.